Hello, this is Dr. Soheila Rostami. I'm an oculofacial plastic surgeon, double board certified. So we discussed upper eyelid and eyebrow last episode, and we discussed how you can differentiate between eyebrow ptosis, eyelid redundant skin, and eyelid ptosis. So we kind of figured out what the differences are. So eyelid ptosis, as you can remember in this presentation, in a child, this is called the eyelid ptosis, and this is in an adult. So eyelid ptosis. Now eyebrow ptosis is more explained here, and I'm gonna mark it in a, I'm gonna fold this so you won't confuse. So this is the eyebrow ptosis. So this is eyebrow ptosis. So the eyebrows are not even, and they're not sitting in an appropriate position. So it could be bilateral and it could be unilateral. Now, a lot of you guys, when you come in, you have been told by somebody you need an eyebrow lift, not eyelid surgery. And when I tell you need both or you need just one, you get all confused. So remember, it's very important to know where your eyebrow sits. And eyebrow ptosis only repairs the position of the eyebrow, and we really don't want, so eyebrow position is very important in a way that shows your emotions. From the eyebrow position, you could be pursued as being angry, can be pursued to be sad, happy, anxious, or like surprised. So the reason it's so important to know where the eyebrow is sitting and what you need is because later on it will make you to look more surprised, more anxious, or excited, or angry, or sad. So these are the different emotion that comes with the position of the eyebrow. So it's very important not to overcorrect or undercorrect the eyebrow. Eyebrow position is so important in your facial expression. So we really need to pay attention where we correct and put the eyebrow. And there are different surgical procedures to correct this. So there are endoscopic eyebrow lift for correction of the eyebrow. Could be direct eyebrow lift. It could be trichophetic eyebrow lift. So you have to talk to your doctor and make sure that you understand why the doctor recommends certain procedures for your eyebrows, or do you really need the eyebrow position corrected. So remember what we discussed. We discussed the eyelid skin and eyebrow are kind of like intermingled, and it's very difficult to say where it sits. The distance between the eyelashes and the eyebrow is so important to be kept or renewed to the position that you had when you were younger. So these are important to look at the photos, see where your eyebrows were sitting, how the shape of your eyebrow was, to be able to deliver that back to you. So those are very important. Now, in female patients, they are occasionally that they do tattooing of their eyebrow before the correction of where the eyebrow is supposed to be. Now, when you have already done microblading or some sort of a tattoo correction of the eyebrow, it's very difficult for us now to correct the eyebrow position, because if we, God forbid, change that position of the eyebrow that was drawn for you, then again we're going to mess up that appearance of sadness, surprise, and all that. So it's so important to not to get the eyebrow tattoo done prior to be evaluated for the correction of the eyebrow position. So I tell my patients often when they come in, and they really have eyebrow ptosis, and they should have had that corrected long time ago, but they have gotten the eyebrow tattoo, and I tell them, I can't correct this. And the reason is because we can't get rid of the eyebrow tattoo permanently right now without getting rid of all of your eyebrows. It burns it because it goes after pigment. So if you have eyebrow already, it's going to burn all your eyebrow if we try to get rid of the tattoo. And the tattoo doesn't really go away completely. So it's very difficult to correct the eyebrow if you getting it tattooed prior to correction. So keep that in mind whenever you're coming in for any kind of eyelid eyebrow evaluation. So eyebrow tattooing, if you're going to do it and you haven't done it, I would suggest to get the eyelid evaluation prior to your eyebrow tattooing. That's very important. Now, different type of procedures that are done for eyelid ptosis. Now, we discussed the eyebrow ptosis. Now, there are different types of surgeries that can be done for the correction of the eyelid ptosis. So this is eyelid ptosis. That is, we actually have three common procedures that are done for eyelid ptosis. In children, we can do all three. In adult, we most of the time do only two of them. So one is a common one is called levator advancement. Levator muscle is what lifts our eyelids. So levator advancement is the tightening of that muscle that gives us a nice lift. Another muscle that also is important in eyelid lift is Mueller muscle, and Muellerectomy is another treatment for adults for the ptosis, eyelid ptosis. Now, in children, we can use different type of slings to correct the ptosis, congenital ptosis. So that is usually used in children or with congenital ptosis. And the slings could be silicone, it could be part of a muscle covers, the sheets that we harvest. So there are different types of slings that we use to correct that ptosis with the frontalis sling that we call. So those are the different methods that we correct the ptosis in patients. So that can be combined with upper eyelid blepharoplasty. And remember, upper eyelid blepharoplasty only corrects the excess skin or redundant skin of the upper eyelid. We assess how much excess skin exists, and we remove the excess skin that is redundant. It's so important to go to the right individual surgeon to do this procedure, because if they take too much, then you're going to have what we call lag ophthalmos. Lag ophthalmos means that you're not capable of closing your eyes properly, and that is serious problem because it's going to create issues with your cornea, with eye itself. It will make it painful, irritated, and possibly, God forbid, if it's severe, it can cause even vision loss. So it's so important to make sure that you don't take too much skin of the upper eyelid. Another thing that is very important is the fat in the eyelid. So as we get older, we get some herniation of the fat, upper eyelid fat, especially the medial corner. We get these little bubbles in the corner of our eyes, and when you're coming for assessment of the upper eyelid blepharoplasty, if you do have that, it should be removed and repositioned, because sometimes we lose the fat on the other sides of the eyes, and it gives us a very empty, hollow eye, and that's a telltale sign of aging. And if we reposition it, the fat that we are removing, it can help with that hollowness look of the upper eyelid. We do also fat transfer. So also fat transfer is very important if you do have that hollow look of the upper eyelid, to help with making the eye look more youthful. So those are the different techniques we add to upper eyelid blepharoplasty to make the eyelid look much more youthful. I hope this was clarifying what type of surgery there is for upper eyelid and eyebrow repair. Thank you for your attention.